Good morning, children. Today we are going to discuss about why do we fall ill. See, health is therefore a state of being well enough to function well physically, mentally, and socially. What is disease? Disease is any condition that may lead to discomfort, distress, health problems, or death of the affected person. See, types of disease. Diseases is divided into congenital and acquired, infectious, non-infectious. Infectious is contagious, non-contagious. Non-infectious, deficiency disease, metabolic disease, degenerative cancer disease, metabolic allergies, injuries. Types of disease. Acute disease. Some disease last for only very short period of time, and these are called acute disease. Example, common cold. Other ailment can last for a long time, even as much as lifetime, and are called chronic disease. Example, elephantiasis tuberculosis. See the picture, the elephantiasis and tuberculosis. A person may contract pulmonary tuberculosis for inhaling droplets from a cough by an infectious person. See the liver, lungs tissues. Disease are caused by pathogens like virus, bacteria, fungi, protozoans, or worms. Poor health and undernourishment, malfunctioning of body, environmental pollution, genetic disorders. A difference between healthy and disease free. Healthy, it is a state of physical, mental, and social well-being. It refers to individual physical and social environment. The individual has good health. Disease free, it is a state of absence from disease. It refers only to the individual. The individual may have good health or poor health. Infectious diseases, infectious agents, means of spread, organ specific, tissue specific manifestation. Principles of treatment, principles of prevention. Infectious agents, organisms that can cause a disease are found in wide range of such categories of classification. infectious agent disease, virus disease, common cold, influenza, dengue fever, AIDS, now is endangered in COVID-19. Bacteria, typhoid fever, cholera, tuberculosis, anthrax. Fungi, many common infectious diseases. Protozoan, malaria, kala azar. Worms infectious, elephantiasis. Why is important that we think of these categories of infectious agents? As an example, let us take antibiotics. They common block biochemical pathways important for bacteria. Many bacteria, for example, make a cell wall to protect themselves. The antibiotics, penicillin, block the bacterial process that bind the cell wall. As a result, the growing bacteria become unable to make cell walls and die easily. A means of spread of infectious diseases, airborne diseases, common cold, pneumonia, tuberculosis, waterborne disease, cholera, amoebosis, sexual transmitted disease, syphilis, AIDS, through vectors, Anopheles mosquitoes, vector of malaria. Name of the spread of infectious disease. Infectious disease spread from an infectious person to a healthy person through air, water, food, vector, physical contact, and sexual contact. Through air, common cold, tuberculosis, pneumonia, etc. Through water, cholera, amoeba, dysentery, etc. Through vector, mosquito, malaria, dengue, yellow fever, etc. Flies, typhoid, tuberculosis, diarrhea, dysentery, etc. Through sexual contacts, syphilis, AIDS. AIDS virus can also spread through the blood transfusion and from the mother to the child during pregnancy and through breastfeeding. Organ specific and tissue specific manifestation after entry of microbes in our body. Where do they go? See the picture. Inhale our food, the digester, our digestive system, the excreta is come to outside. Example, the tuberculosis cause bacteria entry point through nose to lungs. Prevention methods of some common disease. Typhoid, proper sanitation and disposal of fecal matters prevents infections. Typhoid oral vaccine also prevents typhoid. TAB vaccination provides immunity for 3 years. Diarrhea, community hygiene is also important. Eatables should be covered to prevent contamination. Stale food should not be consumed. Proper personal hygiene is also very important. See, the cluster is there, uh, tuberculosis, isolation and proper rehabilitation of the patient, avoidance of overcrowding, provision of good ventilation, and better help to reduce the incidence of the disease. Types of disease. Congenital disease. The disease are those which are present since birth. They are caused due to genetic abnormality or due to metabolic disorders. Acquired disease. These diseases are those which are developed after birth. They are classified into two types: infectious diseases, non-infectious diseases. A difference between acquired, acute disease, chronic disease. They are short duration disease. They are long lasting disease. Patient recover completely after the cure. Patient does not recover completely. There is no loss of weight or feeling of tiredness afterward. There is often loss of weight or feeling of tiredness. There is short duration loss of work and efficiency. There is a prolonged loss of work and efficiency. Causes of disease. Causes of disease are explained below. Immediated and contributory causes. Immediate causes. The organisms that enter our body and causes disease is called immediate cause. For example, virus, bacteria, protozoa, etc. Contributory causes. The secondary factors which lead these organisms entry our body are called as contributed causes. For example, dirty water, contaminated food, improper nourishment, poor standard of living. Infectious and non-infectious causes. Infectious causes. They include the agent like microbes or microorganisms are the immediate causes which spread the disease from an infectious person to the healthy person. Non-infectious causes. The disease which does not spread by contact between infected and healthy person through air and water is called non-infectious disease. Infectious non-infectious disease. Infectious disease, the disease which is spread due to infection by microorganism are called infectious disease. When a disease causing organism enter our body, it causes infection. It multiplies and grows in the body called host, and microorganism multiply in the host body. For example, tuberculosis, tetanus, common cold, AIDS. Non-infectious diseases. The disease which does not spread by contact between infected and healthy person through air and water is called non-infectious disease. For example, cancer, genetic abnormalities, high blood pressure. Principles of treatment. The treatment of infectious disease consists of two steps. They are to reduce the effects of the disease symptom and to kill the microbes which cause the disease. To reduce the effect of the disease. This can be done by taking medicine to bring down the effects of disease like fever, pain or loose motion, etc. And by taking bed rest to conserve our energy. To kill the microbes. This can be done by taking suitable antibiotics and drugs which kill the microbes and the disease is cured. See the picture, the pig getting the water and climates of food, space, breathing side effects is transmitted to mosquito. It go to first birds and mosquito, both are exchanging, and pig, the mosquito is go and bite for pig, the same mosquito is bite for human being. And Japanese encephalitis, brain fever, virus enter through the mosquito bite infection to brains. They go and bind for bite for the human being. The virus is transmitted to brain. That's called Japanese encephalitis. Go and affect for the brain. Malaria transmitter cycle. The transmission of disease. A malaria transmitter cycle. The uterus, the initial human host, first vector as a mosquito, pseudopodium is another one. This transfer for both male and female and cause by liver infection and blood infection, and second vector of mosquito, next human host. See the picture of this. Malaria from mosquito, AIDS and HIV also the producing for virus. The spreaded of disease, mosquito and AIDS virus. Medicine, microbes, viruses, bacteria, fungi and protozoa. Antibiotics. These are the chemicals, medicine, drugs that block biochemical pathways important for bacteria. They are used for disease caused by bacteria. Antibiotics do not work against viral infection as the viruses do not have their own biochemical mechanism but depend upon that of the host. Principles of treatments. To reduce the effects of the disease by taking medicine to bring down the effect of disease like fever, pain, etc. and by taking complete rest to conserve the body's energy. To kill the cause of the disease by taking suitable antibiotics and drugs which kill the disease causing microbes. Principles of prevention. General method, they involve a preventing exposure against microbes by boosting the immune system. Preventing exposure against microbes can be done in the following ways. For airborne microbes, we can prevent exposure by avoiding overcrowded place. For waterborne microbes, we can prevent exposure by not using contaminated water. For vector-borne infectious, we can prevent exposure by providing clean environments. By boosting the immune system, our immune system play an important role in fighting against the microbes that enter our body. Strengthening the immune system can help in preventing many diseases. So proper nourishment or healthy diet that includes all the necessary nutrients as well as vitamins and minerals is necessary for better functioning of our immune system. Specific method. It involves the prevention method directly against a particular disease. It is done by immunization, which is the process of introducing a weakened pathogen inside the body of the host to make his or her immune system to produce antibodies against that particular disease, so that the next time, even if the disease will strike the host body when full vigor, the body will be able to protect itself with the help of these antibodies. Every kind of disease is not under our control, but the last we can care of ourselves and our surroundings. See the picture, the better sanitation is maintained, our health is good. Hand washing is frequently hand washing for removal of the germs in our hands, and providing vaccine at right time for children. The birth and getting for the immune system is developed, that time using for lot of vaccination is available, giving the right time to give the children for vaccination. The impact of good health. You know that health habits such as eating well, exercising, and avoiding harmful substances make sense. But did you ever stop to think about why you practice them? A healthy habit is a behavior that benefits your physical, mental, and emotional health. These habits improve your overall well-being and make you feel good. Healthy habits are hard to develop and often require changing your mindset. But if you are willing to make sacrifice to better your health, the impact can be far reaching regardless of your age, sex, or physical ability. Here are 5 benefits of a healthy lifestyle. Controls weight. Eating right and exercising regularly can help you avoid excess weight gain and maintain a healthy weight. According to the Mayo Clinic, being a physically active is essential to reaching your weight loss goals. Even if you are not trying to lose weight, regular exercise can improve cardiovascular health, boost your immune system, and increase your energy level. Plan for at least 150 minutes of moderate physical activities every week. If you cannot devote this amount of time to exercise, look for simple ways to increase activity throughout the day. For example, try walking instead of driving. Taken the train instead of the elevator or pace while you are talking on the phone. Eating a balanced, calorie managed diet can also help control weight. When you start the day with a healthy breakfast, you avoid becoming overly hungry later, which could send you running to get fast food before lunch. Additionally, skipping breakfast can raise your blood sugar, which increase fat storage. Incorporated at least 5 serving of fruits and vegetables into your diet per day. These food, which are low in calories and high in nutrients, help with weight control. Limit consumption of sugar beverages such as soda and fruit juices, and chooses learned meats like fish and turkey. Improves mood. Doing right by your body pays of you for your mind as well as the Mayo Clinic notes that physical activity stimulates the production of endorphins. Endorphins are brain chemical that leave you feeling happier and more relaxed. Eating a healthy diet as well as exercise can lead to better physique. You will feel better about your appearance, which can boost your confidence and self-esteem. Short-term benefits of exercise include decreased stress and improved cognitive function. It's not just diet and exercise that lead to improved mood. Another healthy habit that lead to better mental health is making social connection. Whether it's volunteering, joining a club, or attending a movie, communal activities help improve mood and mental functioning by keeping the mind activities and serotonin levels balanced. Do not isolate yourself. Spend time with family or friends on a regular basis. If not every day, if there's physical distance between you and loved ones, use technology to stay connected. Pick up the phone or start a video chat. Combats diseases. Healthy habits help prevent certain healthy conditions such as heart disease, stroke, and high blood pressure. If you take care of yourself, you can keep your cholesterol and blood pressure within a safe range. This keeps your blood flowing smoothly, decreasing your risk of cardiovascular disease. Regular physical activities and proper diet can also prevent our help you manage a wide range of health problems, include metabolic syndrome, diabetics, depression, certain type of cancer, arthritis. Make sure you schedule a physical exam every year. Your doctor will check your weight, heartbeat, and blood pressure, as well as take a urine and blood sample. This appointment can reveal a lot about your health. It's important to follow up with your doctor and listen to any recommendation to improve your health. Boost is energy. We all experience a lethargic feeling after eating too much unhealthy food. When you eat a balanced diet, your body receives the fuel it needs to manage your energy level. A healthy diet includes whole grains, lean meats, low fat dairy products, fruits, and vegetables. A regular physical exercise also improves muscle strength and boosts endurance, giving to more energy. Say to Mayo Clinic, exercise helps deliver oxygen and nutrients of your tissue and gets your cardiovascular system working more efficiently so that you have more energy to go about your daily activities. It also helps boost energy by promoting better sleep. This helps you fall asleep faster and get deeper sleep. Insufficient sleep can trigger a variety of problems. Aside from feeling tired and sludging, you may also feel irritable and moody if you don't get enough sleep. Want more? Poor sleep quality may be responsible for high blood pressure, diabetics, and heart disease, and it can also lower your life expectancy. To improve sleep quality, stick to a schedule where you wake up and go to bed at the same time every night. Reduce your caffeine intake, limit napping, and create a comfortable sleep environment. Turn off light and the television and maintain a cool room temperature. improves longevity. When you practice health habits, you boost your chances of a longer life. The American Council on Exercise report on a 8-year study of 13,000 people. The study showed that those who walked just 30 minutes each day significantly reduced their chances of dying prematurely compared with those who exercise infrequently. Looking forward to more time with loved ones is reason enough to keep walking. Start with short 5 minutes walk and gradually increasing the time until you reach up the 30 minutes.